Hello, I'm Susan Gardella, and this is Nursing 330, the head and neck evaluation. And I'm going to, I made sure that the room has privacy. I've gathered my equipment. I have done hand hygiene, make sure that everything is safe, the environment looks good. I introduce myself. Hello, my name is Susan Gardella. I'm here to do the exam of your head and neck. Can you tell me your name, please? And she's going to tell me her name is Florence Nightingale. And can you tell me your date of birth? And it's 5/20/1820, 5/12/1820. And she will tell me that she is, where do you know where you are right now? She's at Stratford University. And can you tell me the date? And June 2013. And that's appropriate. You do not have to, an older person may not know the exact date, and that still means she's oriented. So she's oriented to person, place, time. I will inspect her to see generally how she looks. She came in with good posture, walked in, able to get onto the table comfortably, good gait, well nourished, slim, skin is fair. No obvious rashes on first examination of her, and her hair looks evenly distributed. She's appropriate expression, and been talking, speech is clear, and she's able to hear me. She has a hearing aid in, but she is able to answer me clearly. So I will do the vital signs, check the temperature, the pulse, the blood pressure, and do her pulse ox. And do you have any pain? And she denies any pain. And I would also check her height and weight, and compare and do her BMI, and check to see if her Snellen eye chart. She got a 20/20 wearing her glasses. That means with correction. And so she's ready for the rest of the exam. And when I look at her, I look at the head first. And it's normocephalic, and I already said her hair is clear, no lesions, no bumps. I'm going to assess, palpate. So I inspected it and palpated, and I don't feel any lesions or bumps or any hair loss. And I'm going to ask you, may I take your glasses so I can examine her? And examine her face, and I'll ask her to smile and puff out her cheeks and see if her facial expressions are symmetrical. She has a slightly asymmetrical look on her right eye here droops a little bit, and her eyebrows are not symmetrical. When I look at her eyes, the sclera is clear, pupils are irregular, and I don't see any discharge, and the conjunctiva is clear. Eyebrows are evenly distributed, and I would look and check her pupil response to see if the pupils, if they're round, equal, which they aren't, but I'm checking to see if they're round, if they're equal, they react to light, and I'll have her look at this and follow in to see if they accommodate, and they constrict as I move closer. So the pupils are pearl. I would look at to see if the light reflects on the same place on each eye, which they do. I will have her follow to see the 6 cardinal fields in 1, 2, 3, and back to neutral, and go the other direction to have her follow with her eyes. And so she does do the 6 cardinal fields. I can do confrontation tests by having her cover one eye and I'm covering my eye to see if she's able to see from the periphery, to check for peripheral vision, and I would do it with both eyes. So the other part of the eye exam I can do is to check for the internal structures, and I would have her look straight across, and I would have the lights dim and to see the red reflex, and to look in to see if I see any vessels, and follow the vessels and find the optic disc. And then I would look at the other side and get the red reflex there, and the same to see if I see any abnormalities. So a red reflex times 2, normal structures. Look at her nose, and it's slightly deviated at the top. I would ask her to occlude and sniff to see if it's patent. If I see any discharge or erythema, the mucous membranes are pink and no discharge in the area. I will check her lips are pale, no cracks or lesions. She wears dentures. I would want to look underneath to see if how the mucous membranes are, make sure there's no damage and there's no problems along the gums or lesions, and say, watch her uvula rise. Have her stick out her tongue to see if she can check for the hypoglossal, and if it comes out straight, and looking at the back of the pharynx. And that's clear. We've looked at her mouth. So we've looked at her eyes, her nose, her mouth. I palpate to see any tenderness, the frontal sinuses, the maxillary, and tend to have her open and close her jaw, palpate the temporal pulse to feel if it's equal. And if she has any discharge in her ears, any tenderness, so I would inspect and check tenderness. And I would also look without the hearing aid to see if there's any discharge, and look at both sides. They are placed symmetrically. I'm going to look in her ears, check if there's no discharge. The canal is pink and clear, and her tympanic membrane is gray with good light reflex. The same on this side. Canal is clear, good light reflex on the tympanic membrane, pearly gray. I want to check her hearing. I would cover this, you say, whisper to see if she could hear. I took out her hearing aid, so she might have trouble with that, and I would have to put that back in. And to see if she could hear under that. I would make sure and check both sides. Now the others, I will check for her hearing with the tuning fork. Because she has a hearing problem, I would expect that she would be following up to check on her last exam when she's been seen. I want to check with the Weber test and ask, can you tell me if you hear it in both sides? And she says yes, to see if it's symmetrical. And then the Rhine test, do you hear that? She'll say yes, tell me when it stops. It's stopped, then I'm going to put it, can you still hear that? Yes, tell me when it stops. To make sure air conduction is twice as long as bone conduction, and I would do the same on this side. Tell me when that stops. And then she'll say, and then she still hears it, tell me when that stops. So we've checked, and her neck, her trachea looks midline in there. I'm going to check her carotid, one side at a time. Good, strong carotid, even, and and check if there's her thyroid. I'll palpate gently and have her swallow and feel. I can also do it from the back and relax her muscles so that I can feel the lobes of the thyroid. And I can also check her occipital, post-auricular nodes, along the tonsillar, submaxillary, submental, along the cervical chain, superficial, posterior, deep cervical chain, one side at a time. I'm going to ask her to raise her shoulders up against pressure to see if she's got her cranial nerve 11, and checking her, also her movement of her neck, and if she'll push against my hand on this side and then this side. I'm also part of looking at her hands, her skin, see if there's any skin lesions or rashes that I notice, and checking her circulation and fingernails to see what her, which they have good capillary refill, and her nails look good and pink, and no broken skin or lesions. Thank you. This concludes part 1.